So as opposed to talking more about epidemiology in really abstract terms, I'm going to present to you a case study of occupational epidemiology in action. And this particular case study is going to focus on the epidemiology of fatal injuries in Alaska. So throughout this presentation, I'm going to talk about NIOSH. What is NIOSH? NIOSH is the branch of the Centers for Disease Control and Prevention that focuses on workplace injuries and illnesses. And there are a number of locations throughout the country, including one in Denver. But the location that I'm going to focus on presently is up in Alaska, in Anchorage. NIOSH takes a public health approach to preventing workplace injuries and illnesses. There are 4 essential steps of the public health approach. The first step is conducting surveillance for diseases and injuries. In other words, keeping track of injuries and illnesses in the population. The second step is doing epidemiology, is conducting epidemiologic analysis on the surveillance data that's collected in step 1. The third step is developing and implementing targeted interventions to prevent people from getting sick and injured. And then the fourth step is using the surveillance data to evaluate whether or not the intervention worked. And this guy in the beard is C. Everett Koop. If you don't know who he is, you should look him up. Between 1980 and 1989, Alaska's occupational fatality rate was more than 5 times the national average occupational fatality rate. In other words, workers in Alaska were dying much more frequently on the job than workers in other parts of the country. Now you might say that Alaska's dangerous. It has grizzly bears and moose and bad weather and big mountains and so on and so forth. Well, the occupational fatality rate in Norway was significantly lower than the average occupational fatality rate in the rest of the country, not to mention Alaska. And this low rate in Norway suggested to people at NIOSH that the weather and the industries alone didn't explain Alaska's high rates. After all, Norway had similar climate, similar geography. Norway had commercial fishing and oil and gas development just like Alaska did. So people at NIOSH said, maybe there's a way we could impact the rates in Alaska. So what did they do? In 1991, the NIOSH Alaska Field Station was established, and shortly after that, NIOSH established the Alaska Occupational Injury Surveillance System, otherwise known as OWIS. This is the first step in the public health approach, right? Is setting up a surveillance system. Well, in 1992, NIOSH also developed the Interagency Working Group for the Prevention of Work-Related Fatalities. We'll talk about that in a little bit. Now, the occupational fatality surveillance system that was set up in Alaska by NIOSH was broader and more holistic than you might assume. In addition to connecting to folks like the State Medical Examiner and the Bureau of Vital Statistics, NIOSH reached out to the National Weather Service, to the news media, to the National Transportation Safety Board, and the U.S. Coast Guard, because each one of these organizations that eventually became involved in OWIS had data and collected data that could be useful for keeping track of occupational fatalities and risk factors for occupational fatalities. Once NIOSH had their surveillance system in place, they could start with the step 2 of the public health approach, namely epidemiological analysis. The types of questions that they could explore were who's getting injured, how many people are getting injured, and how frequently, what's causing people to get injured, and identifying causes of injury, of course, then might lead to potential prevention strategies. Now, something to point out here is that even though this rate in Alaska is significantly higher than the U.S. as a whole, the Alaskan rate is the average rate in Alaska. And maybe not surprisingly, there was a fair amount of variability between different industries in the state of Alaska in their occupational fatality rates. These differences between industries are reflected in differential fatality rates for different occupations. So over here, that really high rate, that average rate that dwarfed the US and Norwegian rates, is pictured over here on the left in green. You can see that commercial fishermen and commercial pilots were at a much higher rate than the average Alaskan worker of dying on the job. You don't need a PhD in epidemiology to say, maybe we should focus on commercial fishermen and commercial pilots. But there was one occupation that was even higher. Pilots in the helicopter logging industry experienced an occupational fatality rate that was unprecedented. One of the epidemiologists doing this work, involved in this work, said that this helicopter logging pilot fatality rate was higher than the fatality rate for helicopter pilots in the Vietnam War. Now, I should add a caveat. The helicopter logging industry in Alaska wasn't particularly big, but that's one of the primary reasons why epidemiologists look at rates in addition to numbers. If these epidemiologists had focused on numbers alone, they wouldn't have been able to identify helicopter logging as a huge opportunity for preventive action. NIOSH analyzed this fatality data in a number of ways. So in addition to looking at the occupations, NIOSH analyzed the occupational fatality rates within the commercial fishing industry by the type of fishery. And they identified that fishermen in the shellfish fishing industry had much higher occupational fatality rates than fishermen in the herring fishing sector or the halibut sector or all other fisheries combined. This data is why the Alaskan crab fishing sector for a long time was referred to as the deadliest catch. Now, of course, in addition to looking at rates, it is important to look at the number of occupational fatalities. This is some data that NIOSH analyzed looking at occupational fatalities by the circumstances of death. During that initial decade, they were working in Alaska, and they found that the leading causes of occupational injury deaths in the state were drowning and aircraft crashes. Now, I mentioned before that there are 4 steps in the public health approach. The hidden step in the public health approach to disease and injury prevention involves forming partnerships for prevention. NIOSH formed the Interagency Working Group to identify and prioritize prevention opportunities. There was some overlap between the Interagency Working Group and the Occupational Injury Surveillance System, but this was really the group that decided what to do about Alaska's high rates. There were some really important additions to the Interagency Working Group that weren't present in the surveillance system, including industry and trade associations and occupational safety and health professional associations. These were the people who had the local and industry-specific knowledge that could really inform the development of effective intervention strategies. The Interagency Working Group decided to target helicopter logging and commercial fishing just to start off with during the initial decade. There was some progress made in commercial aviation, but these were the 2 occupations and industries that were the initial focus. To identify risk factors and potential interventions, NIOSH and the Interagency Working Group used the Haddon Matrix, which is named after William Haddon, an early pioneer in injury prevention and injury epidemiology. Now, I won't go into the details of how they used the Haddon Matrix, but I will give you some examples of the things that they came up with. Regardless, the Haddon Matrix is useful for classifying both risk factors and solutions. So here are some risk factors that the Interagency Working Group identified in the helicopter logging industry. I won't read these. You're free to pause the video and take a look at them. But I will mention that these risk factors were informed both by the epidemiologic data that NIOSH analyzed, as well as the local expertise of the Interagency Working Group. Then they applied the Haddon Matrix to identify solutions for the risk factors they previously identified. These solutions were implemented widely. So what sort of an impact did they have, and how did they evaluate themselves? Well, from the surveillance data that they collected, NIOSH knew that between January of 1992 and June of 1993, out of 25 helicopters working in the helicopter logging industry, 6 of them crashed, resulting in 9 logging fatalities and 10 disabling injuries. Now remember that NIOSH moved to Alaska in 1991. From July of 1993 through the end of December of 2001, there was only 1 crash and 1 fatality in the helicopter logging industry. Now considering that that 1 fatality occurred over the course of 6.5 years, rather than a year and a half, NIOSH was able to reasonably conclude that their efforts to prevent workplace fatalities in the helicopter logging industry were working. But efforts in the helicopter logging industry didn't stop there. The Trade Association for Helicopter Companies, Helicopter Association International, was part of the interagency working group that NIOSH was organizing. The Helicopter Association International established a helicopter logging safety committee, which went on to develop helicopter logging safety guidelines. And the trade association was able to convince insurance companies that insured them that companies abiding by the safety guidelines deserve discounts on their insurance premiums. And these safety guidelines have gone on to be adopted in helicopter logging operations all over the world. Now, I didn't talk much about the interventions in the commercial fishing industry, but you can look those up in the references I'll provide at the end of this lecture. But NIOSH saw some initial progress there as well. When all was said and done, during their initial decade of progress, NIOSH reported a 49% decline in work-related deaths in the state of Alaska and a 67% decline in commercial fishing deaths. While workplace fatalities still occur in the Alaskan crab fishing industry, it is no longer the deadliest catch. But they didn't stop there. NIOSH continued to work and apply the public health approach to workplace fatality prevention in Alaska, and they continued to have significant success since the initial decade of progress. In the 20 years after the establishment of the NIOSH Alaska Field Station, the occupational fatality rate in Alaska declined a dramatic 84%, as pictured here on the right. One thing that I'd like to emphasize here is that according to people at NIOSH who were involved in this work, the success was a group effort. This was not NIOSH acting alone. This was NIOSH acting as a catalyst in partnership with industry groups, with the Coast Guard, with government associations and government agencies, as well as occupational safety and health professionals. Ultimately, one of the conclusions that we can draw from this case study is that the public health approach, in addition to preventing infectious disease, can be applied to prevent workplace injuries and workplace fatalities. I'd like to thank a few people who gave me guidance and advice as I developed this presentation. Dr. Jennifer Lincoln, Kyla Retzer, Ryan Hill, and Jason Burton, all of whom were involved in this work up in Alaska. And I've also provided 3 publications. If you're interested in learning more about NIOSH's work up in Alaska, I could only really touch on some of the highlights, and there's a lot more detail in these documents.